All right, good afternoon, everyone. Welcome to the University of Nebraska launch of the 2020 Lancet Report on Climate Change and Health. This is one of a handful of regional launch events in the United States and one of only about 30 worldwide. The purpose of this event is to share the Lancet Report findings and to contextualize the report implications for a regional audience. This event is being co-hosted by the Water, Climate, and Health program at UNMC and the Doherty Water for Food Global Institute at the University of Nebraska. I also want to take a chance to thank the Center for Climate Health and the Global Environment at Harvard University, as well as the Global Lancet Office for their support. I'm Megan Langle. I'm the program manager of the newly formed Water, Climate, and Health program, and I'm your moderator for today's event. At this time, I just want to invite all of our attendees to use the chat box to let us know where you're from and what you do. The chat button is located at the bottom of your Zoom screen. We are in Zoom webinar format, so you'll notice that all of the attendees are muted and we can't see your screens. But I do invite you to share any questions you have in the Q&A box during the webinar. The Q&A is also at the bottom of your Zoom screen. I'm going to monitor the Q&A box and share your questions with our speakers during the discussion portion of the event. This session is being recorded and you will receive a link to the video after the event today. It's my pleasure to introduce our webinar speakers to you. We're going to start today with Dr. Jesse Bell. He's the Claire M. Hubbard Professor of Health and Environment and the newly appointed Director of the Water, Climate, and Health program at UNMC. He's also the Director of Water, Climate, and Health at the Doherty Water for Food Global Institute. We also will have Linda Emanuel. She's a registered nurse and agricultural producer. She's the Community Health Director of the AgriSafe Network. Then we'll have Martha Shulski. She's the Nebraska State Climatologist and Associate Professor of Allied Climate Science at the School of Natural Resources at the University of Nebraska at Lincoln. We'll have Rachel Lookadoo. She's an attorney and Director of Legal and Public Health Preparedness for the Center for Preparedness Education at the University of Nebraska Medical Center. Then Monica Cleveland, who is the Environmental Health Specialist for the Winnebago Tribe of Nebraska. And last but not least, we'll have Chris Dethlefs. He is a second-year medical student at UNMC. He helps lead Healthy Earth Alliance, a student interest group working to advance knowledge related to the health impacts of climate change. So we're going to jump right in and start with Jesse Bell. Jesse, whenever you're ready, go ahead and share your slides.
All right. Well, thank you very much for being here today. I really appreciate it. So I'm Jesse Bell, and I'm going to talk a little bit about the Lancet Countdown and the regional release that we're doing here in Nebraska. So first, to start off with, I just want to give you a little bit of background on the Lancet report itself. The Lancet is an international scientific medical journal that's out of the UK. And for about the last 5 years, they've been releasing an annual report looking at the impacts of climate change on human health around the globe. And they've also been narrowing that report down so that you can have regional or countrywide releases as well with closer investigations on those individual countries. So there are at least 120 contributors to this report. There are 38 partner organizations. And like I said, this is a big international report to try to understand the impacts of climate change on human health. Here in the United States, we saw at least 70 academic partners, NGOs, and medical associations that were associated with the US policy brief that came from the Lancet Countdown. This included everything from the American Public Health Association to the American Lung Association to even the University of Nebraska Medical Center. And so with this release of the Lancet, there was a variety of different key findings and findings that came out from the report. And I'm just going to highlight a few of them here. One, that when we were talking about climate change and human health, no country, whether rich or poor, is immune to the health impacts associated with climate change. And the reason that we can say that is because, one, our climate system all across the world has been changing. We have seen changes in temperature, precipitation, and more extreme weather and climate events that have occurred all across the globe. And that has been over the last 50 to 100 years. And we expect that our climate systems will continue to change over the next 50 to 100 years as well. Those changes have direct impacts on our health. And then the next finding is talking about how the COVID-19 pandemic and climate change, they represent converging crises. COVID-19 is a large global public health threat. It does not stop at any border. And it has shown us what potentially a large global crisis can potentially look like. And in a similar fashion, that is climate change. This is a large international issue, public health issue that doesn't stop at any border and impacts all of us equally, or impacts us all. Distribution isn't quite equal. And then as we're addressing the COVID-19 pandemic, one, we're learning a lot about our public health systems and healthcare systems, and we're understanding about some of our vulnerabilities and some of the issues that we have. And so with addressing the COVID-19 pandemic, we also have an opportunity to respond to climate change as well. And that's by improving public health, creating more sustainable economies, and protecting our environment as we build back from COVID-19. So we can't look at these crises independently. So, sometimes when we talk about things like COVID-19, we're like, we have to focus all of our attention there. Well, that's not the luxury that we have because things like climate change are still coming at us. Like I said, we've seen an increase in the frequency and intensity of extreme weather events over the last 50 to 100 years. And those are having impacts on our communities around us. Here in the United States, these are billion-dollar disasters, and looking at billion-dollar disasters, this figure here is looking at billion-dollar disasters in the United States over the last 40 years. One of the things that you'll see is we've been seeing an increase in billion-dollar disasters across the United States over the last 40 years, both in the number of events and also in cost. Last year, it kind of came to head in 2020 when we were already in the middle of a global pandemic, and we're facing the potential health and economic costs and burdens here in the United States. We saw 22 climate and weather related disasters. That was the most we've ever experienced in the United States. And those $22 billion disasters, when you add it all up, led to $450 billion of economic loss here in the US. And so it just talks about the compounding issues that we're facing as we're trying to address and deal with climate change. This isn't the first time, the Lancet report isn't the first time we've had these big, large reports trying to understand the impacts of climate change on human health. There's been previous reports. In 2016, the United States released a national report to try to assess the impacts of climate change on human health. I was one of the authors for that report. It brought together experts throughout the United States to try and understand some of these impacts. There are a number of findings. Here are a couple findings that came from it. One, that climate change is a significant threat to the health of the American people, and that every American is vulnerable to the health impacts associated with climate change. And the reason we can say that is, like I've said, we've already seen a rise in temperatures. We've already seen changes in our extreme weather events. We've seen changes in CO2 concentrations in our atmosphere, and we will continue to see these changes over the next 50 to 100 years as well. Those changes are impacting the environment and impacting our communities around us. And those changes in our community and the impacts on our environment are leading to human health costs. And now I said that all populations are vulnerable, but some more populations are more at risk than others. And this is typically communities of color, older adults, low-income communities, and children. And there's a variety of different reasons for that. Everything from pre-existing health conditions to lack of access to care, to discrimination, and a variety of other issues as well. And so with the report, one of the reasons that Nebraska became a focus, or UNMC became a focus of the report, I've been serving as an editor of this report for a couple of years now. Last year, I brought to the attention of the main authors that maybe there should be some focus on some of the events that have been happening here in the central part of the United States and how climate is impacting our communities around us here in the middle of the US. They agreed, and we had a case study within the Lancet report from the US policy brief that focused on the 2019 flooding. As you probably remember, in the central part of the United States, we saw huge significant flooding that impacted much of this area. in March of 2019, it really kind of started to some extent. It ended up leading to about $10.8 billion of economic loss. There were at least three deaths, hundreds of people displaced, and it was the costliest inland flooding event in US history up to that time. It caused wide-scale damage to infrastructure throughout the Central Plains, and as you can see, there's a variety of different states that were impacted by these flooding events. It led to millions of acres of agricultural land being inundated with floodwaters, killing thousands of livestock and preventing the planting of crops. Here in Nebraska alone, 104 cities, 81 counties, and 5 tribal nations received state and federal disaster declarations. FEMA approved over 3,000 individual assistance applications just in Nebraska alone. Also here in Omaha, we saw a lot of flooding, and it had impacts on military as well. The Offutt Air Force Base, which is right south of Omaha, received flooding. It also had impacts on our healthcare systems and public health. There were at least 2 hospitals that sustained damage. Dozens of long-term care, or a dozen long-term care facilities were evacuated, and there was access to care issues across the state and across the region as well. With flooded roads and damaged infrastructure, that meant the people that needed to go to the hospital had more difficulties of getting there. So we brought about this case study and we talk about this, and what we're trying to do is really talk about how we need to prepare for climate change and make sure that healthcare and public health are doing their best to work on these issues. One of the reasons for that, starting off, especially for anybody that's potentially a medical doctor, you always hear that first phrase when you come to medical school is about do no harm. And that's one of the things that we need to work on. Hospitals can lead America's effort to transform an energy system. Hospitals right now across the United States account for 10% of carbon dioxide emissions in the US, 4.4% worldwide when we're just talking about healthcare and hospital systems. And then transitioning to renewable energy can improve the health of our communities by improving air quality, but also preventing some of the issues that we potentially could see with climate change. Health and health-related sectors should also invest in preparedness activities to prepare for climate change, both protecting their systems and their communities, but also help making sure that they're most at risk and most vulnerable in those communities are safer as well. And then we need to educate and train the next generation of health professionals so that we have an investment in our next generation so that they can better understand the potential impacts that this is going to have on the communities that they serve. And we still need a lot of work in trying to address this in the context of public health. Each of these blue states represents a state that is actively working on climate change and public health, that they're working to understand some of these impacts. As you can see, there's a majority of states that are not working on this and don't have resources or funds invested in to try and understand the impacts of climate change on the communities that they serve. Public health can assist with addressing, educating, and understanding these health impacts of climate change. However, here in the United States, public health spending is somewhere around 1.5 to 3% of all US spending on health and healthcare. So as you can see, we're already spending a very small percentage. And then when you break that down to even a smaller percentage that we're focused on understanding the impacts of climate and climate change on human health. There are 51 countries around the world that are actively addressing, putting together plans to address the health impacts of climate change. The United States is not one of them. So closing thoughts, climate change is a significant threat to both everyone globally and here in Nebraska. All populations are vulnerable, but some are more at risk than others. Extreme weather events are becoming more common and more frequent, and the costs of these events are increasing, including the health costs and the economic costs. So we need to work on preparing our communities to these health threats, and we also need to make sure that we're investing in public health to help address the impacts of climate change. And so with that, I just want to say thank you very much to all my other panelists today. I really appreciate their support in this, and I look forward to any questions that you have. So thank you.
Thank you, Jesse. Next, I want to welcome and introduce our keynote speaker, Linda Emanuel. Linda was heavily involved in the healthcare response to the 2019 floods in her community, and she is here to share her experience with that with our audience today. So Linda, whenever you are ready, go ahead and share your slides.
Thank you, Jesse and Megan, for inviting me to be here today. It is a pleasure. I'm coming to you from North Bend, Nebraska. North Bend is an agricultural town. We are located about an hour northwest of Omaha, right along the railroad tracks, and that is how our community was formed over 150 years ago. As Megan alluded, I am a registered nurse and I work in a community health nurse role with AgriSafe Network. And just a little bit about AgriSafe. AgriSafe was formed over 20 years ago in Iowa by rural nurses who saw a need to educate and advocate for good healthcare practices for farmers and ranchers. I'm also co-proprietor of our family farm here in Nebraska. We are a 3-generational family farm and we grow row crops as well as help our adult sons with their cow-calf herd operation. And so in my lifetime, I had never seen or experienced this unprecedented event of the Nebraska bomb cyclone. And those pictures that you see there are of our volunteer fire department as they were monitoring the river that our town lies right next to. We are called North Bend because we sit right along the northernmost bend of the Platte River, one of the river systems that cross Nebraska. And what happened during that event was in part due some infrastructure that has not been tended to or upgraded for a long time, as well as the weather itself that happened. The Platte River in short note had backed up, causing a levee to breach, and it caused massive farmland flooding. Our population here in North Bend is over 1,200 folks, and there was a forced evacuation. And we then took steps as a community to start recovery operations. So this picture is a picture of just the beginning of the storm. And that storm was appropriately named, I guess, Winter Storm Ulmer. It began on March 12th of 2019. And this is a picture as I stepped outside of our pickup truck. We live on the bluff that overlooks the Platte River Valley, and that's where our farm is, as well as our sons live in other various farm homes in the area. And our oldest called that morning and said, "We are flooding," and they live along the hillside. And so my husband and I quickly got up and went to tend to their needs. And in traveling back and forth on the county roads, which sit, mind you, above the bluff there, we had massive flooding. And that is not normally a place that we would flood. Prior to this event, we had had a snowstorm 2 weeks before that dumped 2 feet of snow. And I know the folks on the western side of our state had trouble with calving, and that calves and cattle were getting submerged in snowdrifts. When the rain came, and it was only not quite 3/4 of an inch of rain, it hit the snow and we had a quick spring thaw. And when that happened on that frozen ground, the water had no place to go. And so what the weatherman climatologist said, it likened it to like water being splattered on concrete. There was no place for the water to go. And so the flooding began. And this feeling, when I stepped out of the pickup truck to take this picture, it was a feeling of eeriness and uncertainty. Prior to the rain, the state climatologist had given a little bit of a warning to area Nebraska counties, and the county that I live in is Dodge County, and Dodge County Emergency Management notified the area communities, including our North Bend City Councilman, that there could be massive flooding. And so the City Council called an emergency preparedness meeting and started putting together the resources that they would need. The picture that you see there was the first day after the rains had stopped, and that is normally dry farmland. The Maple Creek is one of the waterways that drain into the Platte River, and that Maple Creek there had flooded massively. And I remember the sound and the energy of that water as it raced across roads, hitting the bridges, and massive ice chunks as well were hitting our bridges. And remember, this was cold, icy water, at least 30 degrees or below. While we were dealing with flooding out in the country, in town, which was still dry, school was called off and they started a massive sandbagging effort. It was really interesting to see that the community collaboration there yielded to some great community cohesion with the use of the teenagers, as well as other business in the community. They filled over 15,000 sandbags and started to protect our community. The residents that live close to the river, and we have a number of different lake developments, said that the river sounded like a living, breathing monster as parts of chunks would hit the pylons in the bridge, and that water heaved and hoed under that frozen river. We do not have a public health information system, so it was just by word of mouth that residents started coming out and stood shoulder to shoulder with these kids. And kind of the ironic or iconic thing was that just a week prior to, we were standing shoulder to shoulder as a community at the state basketball tournament. Our men's team had unfortunately lost in the finals, but we still earned a silver. And now a week later, here we are trying to protect our community. 2 days after the rain, the levee along the Cutoff Ditch. So in our area, in our county, the bluff drains a lot of waterways and cutoff ditches that help to drain off water off the fields, go straight into the Platte River. And one of the levees that surrounds that cutoff ditch breached. It started off just as a narrow water flow and then quickly turned into a 300 to 400 feet widening flow, which started to flood those nearby lake housing developments. And the evacuations were beginning then in those developments. Again, residents were notified by word of mouth and social media that their potential evacuation was going to happen here in our community. And the plan at that time was to have the refugee center set up in our North Bend Central High School. We were still in a get ready mode, and there was still a little bit, not still, but there was a sense of complacency at that time because the creeks had gone down, the river was looking fairly decent under control, again, being monitored 24/7 as to any flooding. And so folks were just kind of in that get ready mode. 2 days later then, backing up, Megan, essentially the water in that breach had opened it up so that the water flowed down the railroad tracks and then flowed over Highway 30, which is one of the main highways that intersects within our community. And that water then flowed into town. And that's when the evacuation notices were sent out. Again, by word of mouth, our high school system has it's called Tiger Talk. And so the superintendent had sent out to all the students and the parents that there was an evacuation in town. At that time, they had planned for the refugee center to be in the high school because we've got a decent sized high school. But as the water started to surround the high school, those folks that were leaving their homes were told to go north. We didn't have a destination. They just said go north because they were afraid that the high school would become a marooned island. When you go north out of North Bend, 17 miles up the road sits a tiny little village of 300. It's called Snyder, Nebraska. And that sits on higher ground, and that's where folks were told to go. So within this evacuation, then folks were given a half an hour to grab their pets, their belongings, and head to higher ground. We do have a nursing home, or we did at that time, and some of those nursing home residents had to be evacuated by airboats and surrounding volunteer fire departments that could get to us to help evacuate folks also came in to help out. And in Snyder, they were greeted. Again, those residents there did not know, or the Snyder volunteer firefighters were given 5 minutes to prepare. They opened up their doors there's two municipal buildings there, and welcomed the residents in. At this point, the North Bend City Council men had a plan, and that plan had to quick shift because some of those councilmen that were part of that emergency response committee got marooned themselves in different areas. And so communication at that point was a little jumbled and difficult. All along that Highway 79 that goes north out of North Bend sits many farm homes, and along that 17-mile stretch, most homes absorbed folks. Our farm sits on top of the bluff. We took in 10 folks that spent what I thought was going to be 2 days, ended up to be 10 days with us. Our sons took in folks as well, and at times we would have 25 people around our table, and this was important. People needed to share conversation, they needed to share their experiences and emotions, and what I saw as folks gathered, I saw those initial emotions of fear, anguish, and confusion. I noted as they came to our place initially, those who were waiting water had cold, wet, reddened skin, and just trying to warm up and then try to put together what was going on. And our only source of information at that time was social media. Our newspaper editor became our public information officer and showed various drone footage as well as real-time updates as he would talk to the volunteer firefighters as to what was going on in town. In those initial days, this list of reactions I saw, and this would come in waves. The committee, as well as the committee leads and the volunteers, not knowing where do we go from here, how do we get started. However, in those early conversations, there also was that sense of community trust amongst our neighbors and support from credible working partners, and that I think helped to form that initial structure for resilience. What we didn't know, what was in that witch's brew, that flooded waters. During that waiting period, city leadership, and it included a strong leader from our high school, Dr. Endorfer, as our school superintendent, who helped to gather the folks, those leaders that we needed to come together at the table and start the conversation on initial steps. I was part of the door-to-door canvas team, that first team that came into town, and I walked through the hardest ward in notifying folks, knocking on doors, letting them know of the support and the resources that were going to then be located at the high school. Of course, the streets were still slippery as there was frozen ground underneath and very laden with all types of things in the floodwater. What folks came home to, many folks came home to when they were allowed back in town, was a sewage system that that's over 40 years old, had backed up into their homes. And so some folks had 2 to 3 feet of sewage water in their homes. And then of course that spilled out onto driveways and such. What came to my mind initially were those physical human threats of tetanus spores from the soil, plasmosis from the bird droppings, the dead carcasses of animals that were found in the streets and on yards. We are, like I said, an agricultural driven town. The local cooperative had shuttles that had chemicals within that were moved and tipped over in yards. Household oil cans were tipped over. It was deemed early on that the clean water systems were unsafe. There was no potable water to drink. And definitely the mental stress was there. Folks were just trying to digest the uncertainty and where do we go from here. During that first week, the city leaders had formed a command center that was located within our high school, and they met 2 times a day initially, and then changed it to 1 time a day. And they were continuing to assess the needs, review any plans that we had, and continue those coordination efforts. And that truly was where that well-oiled machine really started up to get us back on track. There were 20 different committee leads representing city residents and businesses and rural townships, as well as volunteer coordination and needs. We had representatives there for city water and sewer, disposal. What were we going to do with all of the things, the household things that folks were bringing out of their homes to dispose of, as well as emergency management and people in charge of all the donations that were expected to come. I have to share that communication was key. It was key for successful, efficient cleanup while keeping our volunteers and our victims safe. And the grace in all of this is that we were able to put together all of these committees under one roof. We had our donation depot, which was located in one of our gyms, the command center where we aligned volunteers with victims. We had a room for the post office as our post office was inaccessible. We had a tetanus clinic, and that was early on. The public health department came into town, and for the first 2 days were able to give tetanus shots, but then they had to move on because so many communities along the Platte River were affected. We had Red Cross professionals come in to talk about mental health, and together we really did gel well. We could always find an answer to a question that was needed. On the second day of flood recovery, our command team decided to host a public town hall forum, and that was one of the best things that we did. 300 people were in attendance, and a panel of folks spoke, including the city mayor, recovery committee chairs, the Red Cross, a public health nurse for Three Rivers, and I also spoke well as to the exposures and risks while dealing with cleanup. We also offered the tetanus immunization clinic right there and then, and folks were appreciative. They needed information, they needed it in a timely manner, as well as the support of leadership during this time of crisis. We know that in rural America, we're not going to wait for help. We're going to put our boots on and get right after it. And we needed to have a plan, and that's what we did for those folks. This is the storm after the storm, and we were warned, or not warned, but it was given to us that there will be a deluge of chaos afterwards as volunteers come in to help. And those coordination efforts were well led by folks in our community that know how to get things done. They are the true leaders. We had a volunteer call center that was located in the front lobby of our high school, and it is estimated that there were over 1,000 volunteer days were spent cleaning. Volunteers came from all over the state of Nebraska, as well as neighboring states. And within that command center, we did see that physical raw pain of the victims, and they were needing help, but just not realizing yet what that would mean. And farmers came in as farmers do, and we came in with our heavy equipment with trailers and skidsters, and those trailers were used to load up all the flood-laden debris and bring it to a disposal site. And it was quite an organization, and I feel like we did it well. We had tons of paperwork that we filled out along the way to log in hours and check off the tasks completed. And this is where you would have seen possibly the hay drops that were on some of the national news shows that were given to those cattle that were stranded. This is a picture of our donation depot. Again, as I said, in one of our gyms, all the donations were gathered and organized. We call it the wall of water there you see in the top right hand of your screen. And any type of cleaning supply you could imagine was brought to us. And so it was a matter of organization was key. So what the committee chairs did is had a prescribed list of those cleaning supplies, and as victims came in, we gave them that list, and the victims then would check off what they needed, and then volunteers within that donation depot would take a grocery cart around, fill it up with those items, and then send the folks on their way. And it truly was a seamless system. 3 weeks after the bulk of the cleanup was done, and we felt like our community was fairly secure in where they were in as far as recovery and their needs. Trailers were loaded with the leftover items and then sent down to other Nebraska communities that were still in the cleanup phase. So nothing was wasted. So my work, as I said, is in community health. And when I first came on board to help with the recovery, I was going to be part of the volunteer command center. That work quickly shifted to one of a public health nurse. And thanks to Ellen Dyson, who is outreach coordinator for the Central State Center of Ag Safety and Health, she came to my aid. Somehow Ellen found a way to us. The CS cache is located in Omaha, and the 3 main arteries leading into Omaha were blown apart by the flood. And bless her heart, she came and she brought 200 masks, gloves, and goggles and helped to put together kits. She also gave me time and space and talked about what are the potential health issues that I could see that I would have to address in the days to come. And that was a wonderful, together with her support and the support of my team at AgriSafe Network, I felt like I had resources to share with folks to keep them safe while they were in cleanup mode. I opened up an impromptu clinic for counseling and exposures, and that was in the school library. And I also set up a station as those volunteers and victims came in with a table of PPE that folks were needing to stay safe. In the meantime, AgriSafe, together with CS Cache, quickly put together within a week's time a winter farm flood health threats recovery webinar. And in that, we had a panel of experts from University of Nebraska Kearney who spoke about mental health and the strategies and methods to cope with the mental stress. A professor of microbiology, immunology, with a specific focus on infectious disease, spoke about what was in that, which is brew of water. Professor of Civil Engineering and Biological Systems at UNL spoke about contaminated drinking water, both in rural and in city. And as well as Dr. Yoder with UNMC, who is a professor of environmental, agricultural, and occupational health, discussed farm hazards, the machinery use following a flood, and the livestock and wildlife behaviors. This webinar was free, and it still is available within our learning lab today. Some tips for coping. Along with, as I said, we had a listening ear. We also shared this resource with folks as they came in looking for information. And these two resources as well, AgriSafe has put together a winter flood risks factors during winter recovery, winter flood, which we know looks different than a summer flood. And so we identify those risk factors, and this was given to all folks early on, and it provided that starting point of conversation, those topics that needed to be discussed, as well as the what to wear to clean up mold damage on the farm. It gave us a nice starting point. Hot meals were provided by the American Red Cross when they were able to get to us, and that was a wonderful time for folks just to take a break and a little bit of a respite from the massive cleanup that was going on. And many times, and we had to remind each other and the workers that it's the importance of putting on your own mask, oxygen mask, before you go out to help others. When it came to mental health, we have the emotional highs and lows after a disaster. And certainly this graph supplied by Dr. Tina Chasik with UNK was true to fact. Pre-disaster, there was that getting ready feeling of uncertainty and the impact. And then we went to the heroic where we were high-fiving each other that, yes, we did it. We got the folks out safely. And the honeymoon phase where you're feeling that cohesion, you're working together to make a difference, to get our town cleaned up, and then hit the disillusionment where there is a huge task ahead and the financial loss and the loss in productivity. Anniversary would have been a year ago in March. Well, the pandemic came about, so our focus shifted a little bit, but there still was that sense of apprehension and what's going to happen. Are the river dikes secure? Is that levee put back into good working order? And currently, we do know that the river bank has been restored, so it's got a nice sound physical structure as well as that levee. A personal story, Andy and Stephanie Beckman are a young couple here in town, and their house was very, very hard hit. What you see there in the middle is their basement. They had up to the couch cushions 3 feet of sewer water. The sewer system in their basement and the toilet backed up, and it was like a volcano, spewing sewage everywhere. And as I was talking to Steffi, as she recalled the events, she said the scope of the devastation to their home, she was filled with major emotion. She described the heaviness of her emotions and how difficult it was just to do the simple things as far as getting up in the morning. They were outside of their home, had to live outside their home for more than 10 weeks. And going back in and cleaning up, she said she was just fearful of the changes of who she was at that time, those lost mementos, those lost pictures, those lost traditions. And she did say, though, that there were some great joys in it, in that she got to know the neighbors so much more clearly. They spent time together sharing stories, and it provided that emotional support. And she found out how strong that she really is. And so how does one tackle all of that sewage water? This is a picture of my guys. Again, thanks to CS Cash and other major donors, we were able to outfit the folks in complete PPE, including Tyvek suits, the half mask respirators that you see there, the cut resistant gloves, the boots, and as any farmer knows, you always have duct tape around, and so they duct tape the gloves to the Tyvek suits just to protect themselves. There are special considerations during a disaster, and that goes to our volunteer firefighters. As I said, North Bend, we're a very small community, and so our firefighters are those people who have other jobs during the day. And when the flood hit, it started early on, and they were monitoring the riverbanks and the levee. And then when the fire department itself was flooded, they moved to the high school and set up a command station there. There were many of them that were on duty for 3 to 4 days without rest. They would take breaks and sleep on cots in the gymnasium. And finally, when other folks were able to get to us, other fire departments from surrounding small towns, they took over so that these people could go home just to go see the damage within their own home. And so a consideration there was secondary trauma, that feeling that are we doing enough? The fear that something bad is going to happen. I did note some folks talking about being jumpy, their heart racing, a little bit of shortness of breath, especially as we are coming around to an anniversary date again. When it came to other resources, we also offered the University of Nebraska quickly put up a flood assistance website, and it offered wonderful resources and guidance as to how to clean up things. It offered assistance to our farmers and ranchers as far as getting feed and hay to their animals, and it was just a nice resource for folks to tap into. So who takes care of those farmers and ranchers? Many times farmers will go into those small towns to help out others first. We have the equipment, and we just know how to get the work done. So after town was settled and folks were coming along just fine, our sites within our own farm operation turned to what we had to do. Many of the roads and bridges, as Jesse had talked about, that infrastructure was destroyed because of the power of that ice jam and the flooding waters. And we lost a great deal of soil profile. You see in that upper right-hand corner, that is our land in the Maple Creek that I had talked about, just wore away, at least in some areas, 10 feet of soil. And then what we're standing on there is a sand snowdrift, I like to call it. So much sand was moved about. So how do we go about cleaning up? During the flood, social media was flooding these platform feeds with tons of pictures and videos. And a group from Ohio, a group of Ohio farmers, saw all of these pictures and videos and decided they wanted to do something about it. And so a group of 28 farmers traveled over 16 hours in a caravan, pulling trailers of all types of equipment that farmers and ranchers would specifically need to clean up, including tools and power washers, feeding supplies, fencing supplies, and all donated by the small town communities that they live in. We estimate there's over $28,000 of worth of donations that came to it. And they didn't, at that time, of course, farmers were denying help. They're like, we can handle this, we've done this before. But it truly was a jumpstart that we needed. They were there, they walked quietly alongside of us, just having conversation. And we all know farmers will talk to farmers quite readily and quite easily. And so it was just a nice, refreshing nod to know that we have help out there. And that is part of my question to the group is how do we best keep farmers and ranchers safe during this recovery? And in disaster management, do we have the response needed to mobilize assistance quickly to these folks? Because we are our own unique culture. As Jesse alluded to some of the damages there, those are pictures again of my community. An aerial picture up in the upper right was when the flooding was at its worst. And here in North Bend, we sustained over $3 million in damages. And we know that in agriculture, there were $400 million lost to livestock and at least $440 million to crops. And that doesn't even include the infrastructure to those roads that are leading to farms. So those lessons learned. First of all, as I talked to city councilmen and those city leaders, they said, document. FEMA requests a lot of documentation, and we learned a lot during that whole process. We had some gaps in communication was part of that. Prior to getting into that high school, when we were all under one roof, that all changed, of course. The successes within 40 hours, we had a coordination of recovery with many moving parts. I have to say we had a strong commitment and trust within our city residents as well as the farm neighbors that helped us to jumpstart and conquer the recovery and healing. Another success in that donation depot, over 2007 individual orders were filled, and there were over 160 volunteers just to make that donation depot work. We know that these perfect storms are going to happen again, in which you have a combination of elements that will cause a weather event. And I just want to have folks know that someday happened to us, and it's going to happen to many others. And so how do we best plan for tomorrow? At the end of the day, at the end of this day, we are all connected and we all have an obligation to take care of each other. And so I'd like to thank you. I thank Central State Center of Ag Safety and Health for supporting the work that I do here in my community. I also thank AgriSafe and my team that surrounded me and helped me through this process. And also, again, thank you to Dr. Bell and his team for inviting me to share the North Bend story.
Thank you, Linda. That I think you have provided a really helpful case study that really highlights the need for future preparedness in the state related to flooding events. So thank you. Next, I want to have our panelists each introduce themselves and tell us a little bit about your work related to climate and health. So I'm just going to call on you one by one. We're going to start with the Dr. Shulski. So Martha, go ahead whenever you're ready.
Yeah, hi. Thank you, everybody, for being here today, and I appreciate the invitation to speak with you all. So again, my name is Martha Shulski. I serve as the state climatologist for Nebraska. I'm also an associate professor in the School of Natural Resources at UNL. And for those of you that are not familiar with the State Climate Office, we exist as a climate help desk, and we deal with all scales of climate, past, present, and future. At the State Climate Office, we also run a weather network, and that's to keep track of current and emerging issues that are impacting our state, like risk of flood. And we just had a question come up about risk of flood this year, or going into a drought. Currently, all of Nebraska is in the abnormal dry or worse category. So we exist to help track these current and emerging weather and climate issues. Our goal is to turn data into information and inform decision making by managing risks. And we do that in various ways. We talk to a lot of different groups around the state. We're just starting to engage with the health community more. In the past, a lot of our efforts have involved the agricultural community and education and the media. Those are kind of our top three in terms of our stakeholders, but we do deal with a whole range of stakeholders, from a second grader doing a science project to Senator Deb Fisher. So that gives you an idea of the spectrum of people that we deal with. We provide talks and presentations. So in 2019, we delivered, I think, 80 talks to over 4,000, a total of over 4,000 people. That was kind of an active year because there was a lot going on and people wanted to know about the flood and how does this fit into the historical context of things, and is this going to be happening more and more? We also do help with planning and preparedness efforts. An example of that is helping the city of Lincoln with their master water plan. Will the Wellfield and Ashland be enough to support the residents of the city of Lincoln, given the context of climate change? So that's one example of the kind of help, assistance with decision making that we provide. So I just wanted to reinforce some of the points that Jesse brought up. The fact that climate change is real and here now. So we don't need to wait for it to happen. It is already here and it's impacting all of us. Like the flood of 2019, the question is not, did climate change cause it? The question is, how much worse was it made by climate change? How much worse are these droughts made by climate change? That's really the question, rather than did climate change cause it, because it's already here and impacting all of us. A couple of other points that he made that I thought were really good. The impacts are felt disproportionately. Those that are least able to cope are least responsible for this. So that disproportionality certainly plays out with the health implications. And so that's a facet that we need to tackle in multiple angles with regard to climate change impacts. We are the cause of this current climate change, but we are also the solution. So that's really an important thing to think about, is planning and preparedness, mitigation of future climate change, adapting to what's coming our way, knowing what's coming our way and planning for it. We are the solution for this. And another point I wanted to bring up is there are a lot of nuances to climate change. When you look in Nebraska, it's difficult to give one number for the amount of climate change in the state. What happens in North Bend, like for Linda, is different than what's going to happen in Scotts Bluff out west. So Nebraska sits at what I call the climate crossroads of the country, right? We're so variable in our weather conditions. Normally, we have a very noisy climate, so sometimes it's hard to identify this climate change signal from all the noise. But there's a lot of variability just within the state. The eastern part gets twice as much precipitation on average annually than the western part does, and climate change is manifested differently for different parts of the state. So you really have to look locally at the details of climate change. So there's a lot of nuances to this. Which makes local implications of climate change all the more important and relevant. And just an example of that, it's cold out right now, right? We've had unprecedented cold so far. Februaries, if you look over the last 30 years, Februaries have gotten about 5.5 degrees colder within Nebraska. And there's a reason for that. It's tied to climate change because we tend to be getting more Arctic air outbreaks because the Arctic is warming much faster than the rest of the world. That's causing a more wavy jet stream pattern. And when that happens in the wintertime, we get cold air outbreaks. So an overall warming and climate change is occurring, but what we feel in Nebraska, the weather events that we feel is a cooling during this specific time of year. So what we're experiencing right now is a great example of this, all these nuances and details to climate change. So that's where I think having a local perspective and a local state climate office is really helpful to keep track of these emerging issues that we're seeing because things are changing pretty quickly. We're seeing more extremes, more back-to-back extremes. We had the 3rd wettest year on record in 2019, and now we're at the 15th driest year in 2020, right? We went from extreme wet to extremely dry, and that's going to happen more often. And the implications of that are going to be magnified because of that. So in the interest of time, I should probably stop there, but that just gives you a general overview as to kind of who we are and what we do and the resources that we provide. And I appreciate being on this panel. So thank you.
Thank you, Martha. We'll go ahead and move on to Rachel.
Thanks, Megan. So I'm going to share some screen or some slides. Okay, so I'm Rachel Elkadoo. As Megan said earlier, I'm the Director of Legal and Public Health Preparedness for the Center for Preparedness Education here at UNMC. So I work a lot with state and local health departments on issues of disaster preparedness and emergency response, and some of the legal issues that come up in those things. So that's what led me to working with climate change and extreme climate events and being involved in the Lancet Report case study. So since this is going to be brief, I'm going to focus on 2 practical public health policy actions that we've been taking that I really think we can all participate in. So I think when people think about legal issues and climate change, they jump straight to lawsuits, they jump straight to litigation, and that's understandable. This is a clip from an article from just a few weeks ago talking about how there's been a real spike in climate change related litigation. There's actually been over 1,600 lawsuits in the US relating to climate change. And for reference, the next closest country in terms of climate change litigation is Australia with 97. So we are clearly doing way more lawsuits here in the US. But I mention this because I think what this shows is that these cases are on the rise and more people are starting to think about climate change as something that infringes on their rights. So a lot of these cases are alleging that poor climate change mitigation and climate change itself is infringing on their fundamental right to health. So I think as that awareness grows, it's the time that we can really take some good policy action. So most of us aren't going to file a lawsuit. We're not going to be making legislative changes. So what are some of the public health policy actions that we can take on a smaller scale? I think one of the most important things we can do is start to view climate change as a public health emergency. So formally, public health emergencies are declarations that can occur at the state or federal level, and they provide resources or funds, et cetera, whenever an emergency or disaster occurs that affects public health. And so we've seen these before with hurricanes, but not really with other climate events. We did not have a public health emergency declaration for the 2019 floods. And I think Linda demonstrated really well that that was an event that clearly affected health. So it's unfortunate that those kind of events aren't being viewed through that lens. And until climate change and the resulting extreme climate events are viewed as a public health emergency, they're not going to receive the same resources and attention as other health impacting disasters. So through the Center for Preparedness Education, we've been trying to shift to this protective perspective through some of our work with state and local health departments. They each have to do these annual risk assessments to decide what are the hazards and threats that are the biggest priorities for their jurisdiction. And so we've been trying to help them see that viewing climate events as public health emergencies can help them better prepare. You know, I think Linda touched on this and Jesse touched on this as well, but these floods, they're not really once in 100-year events anymore. These type of extreme climate events are not as rare as we used to think of them. So we need to really prepare for them now, and we need policies and procedures in place to be ready for those kind of events. And the other thing I would say is we really need to establish a climate change and public health community of practice. So this picture is from an event that we actually did with Jesse. This is my colleague, Keith Hansen here, and we had an event relating to drought and human health where we brought together stakeholders from healthcare, public health, emergency management, climate science, etc. And we tried to build a consensus of how we can move forward on addressing the health impacts of drought. And I think that's exactly the kind of thing we need to do for climate change as well. How can we share resources and expertise, and where can we collaborate to implement some really comprehensive measures that address these health impacts? Climate change, as we all know, is a multifaceted problem, and it needs a multidisciplinary approach to really effectuate real change. So I think events like today do a good job of creating this community of practice. If you look at each of the panelists and each of the speakers today, we all come from a very diverse range of backgrounds. We have unique expertise that we're bringing to this. And I think the more of these type of events that we can have and bring together so many different perspectives, the better we can address climate change and its public health impacts. So with that, Megan, I will let you turn it over to whomever is next.
Thanks, Rachel. Let's turn it over to Monica now.
Hello, my name is Monica Cleveland. I am the environmental health specialist for the Winnebago tribe of Nebraska. I'm just going to tell you a little bit about my office and what we do. The goals of the environmental health is to prevent disease and injury for the residents on the Winnebago reservation, and also to build and maintain. For preparedness and surveillance, anything within my office, any kind of emergencies or threats. This is a little bit, I'm not gonna touch base on each one of these. You know, this is what my office does. We do do more than this, but these are kind of the main things. The main thing that I'm gonna touch on is the water samples. We do a lot of water samples within the private wells within our community. I work with the Environmental Protection Office here in our community, working on the ponds and stuff like that. And then we exchange those tests, talk about those tests, try to see what we can do to maybe make things better for our community. And then I want to touch base a little bit about the flood of 2011 and 2019. 2011, this is our casino in 2011. And how much of an impact that it took on our community, because this is our main place where, you know, a lot of our programs within our community run with this casino. And so once our casino is affected, then a lot of our programs that take place within our tribe are affected by that. And so this this flood right here of 2011 got a lot of our community members talking in what we needed to do to be sustainable in case of a disaster. And in 2019, we was very lucky because the flood had little effect on our casino. It, you know, it was, I think it came up behind it, but it didn't really have any effect on it. We did have some lands that were flooded, but no farmland. But in 2011, we had a lot of farmland that was affected by that. And then from this talking, in the past few years, the Winnebago tribe implemented a food sovereignty program. And this is where our Winnebago tribal ranch came from. And within our tribal ranch, this is a lot of what takes place. They have a garden. They recently purchased cattle with this pandemic that came on. They purchased some cattle just in case some of our people were gonna need food. And so recently this summer, they did the purchasing. And so this summer, the chickens and the hogs will come into place, and they already have their greenhouse built out there. And then of course, we have Ho Chunk Inc. Everybody knows about Ho Chunk Incorporated. And within there, they have the industrial farming. And in the background of this picture, you can see the bluffs in the back. That's where this farmland is down there by the Missouri River. And so these are the fields that were affected by that flood. And then underneath Ho Chunk Inc., they have HCCDC, and that's their Ho Chunk Community Development. And they provide raised beds, and they have the farmers market, and these are for, you know, individual people within the community, so they can provide vegetables for themselves, and even, you know, go over to the farmers market and be one of the vendors. And then this past summer, I was able to participate in a climate ready program through the National Indian Health Board. And in there, we were able to talk about, you know, climate and health. And because of all of the gardening and stuff that our tribe is trying to get into, I made up these placemats. These went home to the children in our kids cafe. We have a kids cafe that feeds the children all summer long. And so these placemats went home to them for their families. And then at the farmers market, I do a lot of outreach there, try to be one of the vendors and just do, you know, just hand washing, different things like that there at the farmers market. So I made this a part of it. So those mouse pads and magnets and stuff were given out. And then I've been working with the EPD, the Environmental Protection Office, and we've been kind of collaborating, talking about climate change and trying to get what we're trying to do. In the past month now, we've been kind of talking about educating. I think that's where we're at right now, is we need to start educating our people as far as climate change. I don't know if they really know what it is. You know, we're ahead of it, I guess, a little bit is what I'm saying. You know, as far as the flood, that is a part of the climate change. I don't know if they realize that. But as far as our drinking water and our surface water and stuff like that, I don't believe that, you know, it's being affected right now, but we need to stay ahead of it, I guess, is where I'm at. But I just wanted to elaborate, you know, what my office does and how much we are into, you know, climate change and things that it did affect. And I just want to thank Megan and Jesse for allowing this time for me. And that's it.
Thank you, Monica. And now we will have Chris go.
Everyone, thanks for the opportunity to be on this call. And be a part of this project. My name is Chris Dethlefs. I'm a medical student at UNMC and a co-president of UNMC's Healthy Earth Alliance student interest group, or HEAL for short. So over the last couple of years, I've been really lucky to find a growing body of students at UNMC and really across the country who are passionate about the issue of climate change and its health effects, and who are working towards greater resiliency and sustainability in healthcare itself, as we recognize our future careers will play out in a really different environmental context from that of the past. Our group at UNMC is working on multiple fronts at the intersection of planetary and human health. So we advocate for sustainable policies and practices at UNMC and beyond, and we're working to promote education on the ways climate and environmental change affect human health. At this very moment, we have medical students actively surveying their first year curriculum as they experience it, and to analyze how relevant climate change content could be integrated for future classes. We also have some of our students working on a project to survey currently practicing clinicians in the state to better understand how they perceive climate change and how it will impact their patients, with the thought that this could be an opportunity for continuing medical education credits. As a student-led group, we want to be a platform for ongoing conversations around this topic, to connect students with research projects and to advance sustainability initiatives at the university. UNMC itself has a number of very ambitious sustainability targets, which is great to see. And we want students to be active collaborators and advocates in achieving those targets. So there's a lot of exciting things going on from the student perspective at UNMC in the area of climate and health. One of the things that drew me and continues to draw me to work as a physician is the shared aspiration among health professionals to always improve in clinical practice for the benefit of the patients we serve. There's this kind of instinctive desire to continuously grow and develop as a practitioner as you go through both success and failure. And so the learning never really ends in that. And I think that that's a trait that will be really imperative to an effective response to climate change and the new health risks it brings. I think one of the things this pandemic has shown us is the tremendous ability of healthcare workers and institutions to adapt to unprecedented challenges. And like Dr. Bell was saying, climate change is that kind of cross-cutting, overarching challenge that demands we adapt to these new stressors and to a novel environmental context for all of our future work. And so I think it's critical that people in healthcare in that space bring their adaptive capacity to this new challenge. Communities are going to need guidance to navigate the countless ways that a changing climate affects their lives, including their health. And all these ways we're hearing from our keynote speaker and from these other panelists. And I think that healthcare workers are really well suited to serve as leaders in this regard, given their trusted role in the community and their scientific expertise. And so that's going to require increasing knowledge and awareness within the medical community to understand how climate change impacts individual and community health. And it's going to require that healthcare systems themselves in our state take a leading role in building out action plans and infrastructure and preparedness for adjusting to the changes that are coming and that are already here. So those are just a few thoughts from someone who's early on in their medical training, but really wants to see this topic get more attention in the medical community. It's been really exciting to see how many students from different areas of the medical and public health space come together to address the challenge of our time and of our future. And I hope as we progress through our training, we can bring energy for change to these spaces so that we can continue to provide excellent care and service to patients, even as we face this unprecedented challenge of climate change. So thank you to everyone on the call and to the other panelists for contributing to this.
All right, thanks, Chris. Thank you to all the panelists for being here today and joining us, and for all you're doing to keep Nebraskans safe and healthy. Now it is the audience's turn. If you have questions for anyone in the group, go ahead and type it into either the Q&A box or the chat is fine too. And while you guys are thinking of questions, I'll go ahead and start with one that we have. So Monica, if you don't mind, I'm going to start with you. How can health professionals in training become more informed about the particular healthcare needs of Indigenous communities in our state in general, but also with respect to changing climate stressors?
I think right now, what we're needing right now is probably education, to educate our people on climate change. I'm not sure if they really know exactly what it is. Like, you know, like I said earlier, I assume that they, you know, hear it, you know, hear that word climate change, but I'm not sure if they really know exactly what everything that it pertains to. You know, and I can't speak for our neighboring, you know, tribe, or even Santee up further. You know, I know they were affected by the flood a lot more than we were, you know, as far as homes and stuff. But I'm going to say start with education. We need to start educating them.
Great, thank you. Let's see. We have a question here in the Q&A. What is happening in planning for possible multi-year drought in Nebraska? That might be a Martha or Jesse question.
Definitely a Martha question.
So the state of Nebraska does have a drought plan. And so when a single year drought or multi-year drought occurs, there is a state drought plan in place. It's a little bit dated. I know there's discussion about updating the drought plan. I think it's about 10 years old or something along those lines. In a more continuous fashion. So my office and a number of different agencies inform the Nebraska Department of Agriculture and the governor through the Climate Assessment and Response Committee. So we meet twice a year and talk about current and emerging issues and the current drought. And so we'll be having another meeting here before the growing season starts. So that's one way where we do an ongoing look at that. I also know that some natural resource districts are doing kind of these multi-jurisdictional drought plans as well. They're not implemented among all 23 natural resource districts, but there are some that are taking the lead in drought planning at that spatial scale as well.
We have a question. This is probably for Jesse. Are there any bills in the Nebraska legislature this session that deal with climate change initiatives? Or maybe Martha too.
Or Rachel.
Or Rachel, that's right.
I think there's one. Martha, you might know better than I do. I think there's LB. Okay, all I know is LB 483. You know much better than I do. Martha, I'll let you take this one.
Okay, yeah. So there is 483, which is sponsored by John Kavanaugh. I think he's an Omaha senator. It's a climate action plan, and the language is similar to previous climate action plans that have gone through the legislature, which started in 2015, I think, was kind of the first introduction. So it was heard in the Natural Resources Committee last week, and so it's still in committee discussion. I don't think it's left there. There is also a bill 576 that was heard last Thursday. It's in regard to an update to the 2014 climate implications report that the University of Nebraska did. So it's not a mitigation plan, but it is an update to that report. So those are the two pieces that are directly related to climate going through this session.
So Another question we have says, Chris makes a great point about health professionals as trusted communicators of climate change information. For the other panelists, do you find that trust or lack thereof factor into your experiences talking about climate change in your communities or with your patients? Maybe Linda might have some feedback about that particular question.
Certainly. So again, I work as a community health nurse, and I also work as a producer, as a farm producer. So before COVID, of course, I had opportunities to discuss about climate change and related public health issues. And I think folks are getting used to the idea. Of course, there's lots of controversy out there as far what does climate change, and I think the more education that we get out there, important. I do feel like I'm very excited with Chris and the work that he's doing as a student, and then these new students coming out of these colleges, that they're willing to address climate change and what that means for our health, and how we mitigate some of these climate changes. I think there is a trust. There definitely is a trust within these small towns to look at the healthcare providers, because these patients are sharing their most intimate spaces. And so I think there's a space for it. I just think that we need to be more educated on what that climate change means and look at the hazards versus the whole big climate change. Let those researchers and those people that want to debate that topic, let them do their duty, and those of us here in the rural towns, let's talk about the hazards.
Yeah, I would just jump in on that. I think that's a great point. And Linda and Chris, you also made a great point about how medical professionals a lot of time are a trusted source within the community. And so anything that we can do to help better educate and inform those individuals on the impacts that climate change might have on their community, that's where individuals like me, Martha, and Rachel, and other folks really need to make sure we step in, and other folks across the university system, make sure that that information is reliable and accurate. And then we're also providing that in a timely fashion so that they're able to disseminate that to the populations that they serve. Because there is a lot of, we saw with COVID, there's a lot of misinformation that could potentially happen around various complex topics. And so we need to make sure that we are providing good, accurate, reliable information to our communities. And that is partially through, I think, public health and through healthcare, and making sure that they have that information. So I just wanted to add that on there.
Okay, we've had a couple people interested in knowing more about why hospitals in particular are responsible for so much CO2 emission.
So I guess that'll fall on my shoulders. So hospitals, they're kind of the lifeblood of a lot of communities throughout various areas. You look at places like here in Omaha. We have a number of major hospitals in the city. They are large facilities. They employ a lot of people, and they require a lot of resources as well. Which because of that, they're very energy intensive. And so you're seeing opportunities for changing up those energy systems a little bit to more renewable. And we're seeing that here at UNMC. We're expanding the sustainability efforts at UNMC. I'm in a building right now on campus at UNMC that has solar panels on its roof. These are opportunities that these hospitals across the country have. I guess it's an opportunity to potentially address some of these issues and trying to find more sustainable ways of bringing in resources, energy. But then also on top of it, one of the things that it should be noted, and one of the reasons that, when they were talking about the sustainability efforts that they're promoting here at UNMC and at Nebraska Medicine, it's because this is a part of the community. They are treating the individuals within this community. These individuals are also the ones that are potentially being harmed by some of the pollution that is being released by the hospital. So it's kind of a feedback to some extent. both in the terms of air pollution, if we're talking about energy production, especially based off of fossil fuels, and then also because of the potential implications that it has on changes in the climate, as we talked about, where 10% of US emissions comes from hospitals and healthcare systems. And so we see opportunities like that where, you know, as we diversify our energy sources and we see opportunities where we start to go into more sustainable and renewable energy sources, those are ways that we reduce the impacts that our hospitals have on the communities that they serve and people around them. So I don't know if that answered it, but I took a swing.
All right, thank you. This question is for Linda. To your knowledge, was there a statewide debriefing, or maybe Rachel would know the answer to this, was there a statewide debriefing for the public health communications after the flood? Have you seen policy or preparedness plans since then?
I might defer that one to Rachel. I have not seen, on my level, as well as in community health, I have not seen any plans. There's been discussion about the needs and what do we do with all of what has happened to our rural communities, but I've not seen a formal plan.
So there was an after action report that was released that kind of went through all the lessons learned and things that people ran into. And then I think the intent was to do some real earnest work after that to put in some preparedness plans and mitigation efforts. However, COVID happened and the state health department has just been so overwhelmed with COVID activities that I think the floods unfortunately feel like a distant memory for a lot of people. So I'm hoping that once the pandemic is over, you know, we can go back to working on some of those measures. There'll still be plenty of pandemic lessons learned that we need to work on too. It's never going to be a dull moment, but hopefully at that point we can go back to some of those flood preparedness plans.
Thank you. So this question is for Martha. How do you convince people to take action when they feel local climate change efforts are a drop in the bucket compared to the larger problem of global warming?
Yeah, so I think the big way that you can do that is present the information in a way that it touches people directly. You know, the more local, the more relevant that we can make climate change and connect those dots to something that somebody cares about enough that they're willing to change their behavior, that's how we're going to do it. And so it's, you know, it gets back to who's a trusted source of information. So that was brought up earlier. If somebody doesn't trust you, then they're not going to believe what you're saying is real, or much less take action for it. The frame that you put around the concept of climate change, maybe not even using climate change, maybe using resiliency to extreme weather, whatever it is that will reach people and really dealing with the heart and not the mind. You know, I can put good fancy climate change graphs in front of people and it's probably not going to change their mind, but a good story is. I mean, Linda is a great example of that, and what happened in North Bend. The way we communicated can really make a big difference, I think. So that's, in my opinion, that's the way to reach people.
And I want to add one thing to that. And I think that really, I want to sell that point to health professionals out there about, you have stories to tell, and you have very powerful stories to tell. To this day, whenever I hear somebody talk about climate change, I always think about when we had the release of the climate and health assessment that came out of the White House in 2016, and the Surgeon General, Murdy, giving his talk and talking about seeing patients suffering from asthma attacks and watching children struggle to breathe. That image is still burned in my head to this day because of understanding that relationship between potential for conditions that could exacerbate asthma-related issues because of climate change. And so there are some very powerful stories out there to help communicate this message and help and better inform the communities around you.
Okay, I have another question for you, Jesse. Linda, I don't know, you might want to give some feedback too. If not, that's fine. Agricultural soils have some of the biggest potential for sequestering CO2, but how do we get producers on board with practices? I assume this means that would mitigate that. Carbon credits mandated from the top. It feels like there's a big disconnect. And as an employee of one of Nebraska's 23 natural resource districts.
So I'm going to jump in for just a little bit here, Jesse. Funny question. I had done a little research before this conference about that. We are part of the Nebraska Corn Growers Association. We grow corn, so it's just natural that that would be a commodity we would have a great interest to. And they're working on the state and the national level in talking about more sustainable practices, whether that means cover crops, and some folks might be aware, unaware, in between plantings, in between harvest and planting season, farmers will put seed in the ground to grow these cover crops that protect soil erosion and put some of those good nutrients back into the soil. And they're also looking into some other sustainable practices. And to learn more, I do encourage folks to go to the Nebraska Corn Growers website or the National Corn Growers website. And they will talk more about their leadership in working with producers as well as working with our legislators. So there's plans in motion. We're getting off on the right foot and are getting a good start on this path. And I have talked to Jesse before that the work that he's doing, as well as other state officials within climate change, I think they need to bring that work, as Martha said, bring it down to our communities, to bring it within our local groups so that the conversations keep happening and we get that clear, accurate, evidence-based information.
And I was going to let it, I didn't know, Martha, if you wanted to step in here, because I know that you're familiar with some of the legislation that's coming up that might have something to do with this.
And so you go ahead, Jesse.
Okay. Well, so yeah, you know, it's definitely, and I agree. I think Linda hit the nail on the head. I don't know if there's really much that I can add to that. Other than there are a lot of opportunities that are moving forward. I know that there is some interest about national legislation, federal legislation around change in farming practices for more carbon sequestration. That is potentially being supported by some of our legislators and senators here in the state of Nebraska. I would recommend looking into that, which would provide opportunities for businesses to potentially invest in carbon sequestration. And so that's definitely an opportunity moving forward. If we can drive that incentive, I hope that that would help promote a lot of opportunity for farmers to potentially financially gain from doing the right thing as well. So I don't know if anybody had any other thoughts on that.
I recognize that we're at time. I'm going to ask one more question to Chris, and if any of the attendees need to go, no problem. So I'm going to paraphrase here, but there's a question, Chris, related to whether you're engaging with nurses and HEAL, given that they tend to be highly trusted by their patients.
Yeah, one of the things that's really cool about our student group is it really is multidisciplinary. We have students from all the different colleges at UNMC, graduate studies, nursing, pharmacy, medicine, public health, a lot of different perspectives coming together on this, which I think, makes the effort stronger for having those different perspectives and expertise coming together. And so it's been cool to be a part of that. And we're actively trying to, engage more and more groups who have skill sets to offer.
And I will also add that the efforts that the Water, Climate, and Health program is doing to integrate climate and health curriculum at UNMC, we are also are engaged with the College of Nursing. The College of Medicine, there's a lot of impetus right now at the College of Medicine, but College of Nursing is definitely engaged and wants to be part of that effort for their students as well. All right, well, you guys have a lot of questions, a lot that we weren't able to get to, and thank you for asking them. But we are going to have to conclude the discussion for today. I really appreciate everybody coming and attending the event. And, you know, if you have any questions, please don't hesitate to email me or Jesse or any of the panelists individually. And again, you will be emailed a link where you can watch the recorded version of this after the event. So thank you, everyone, and thank you again to all of our panelists.